Hello, a very good evening. I am Dr. Nilesh Balkawade, Clinical Head, Oasis Fertility Pune and Wakad. I am also the Regional Medical Head of Oasis Fertility. I welcome you all for today's session on the causes of infertility in men and women. We are going to see what are the common causes, and we are going to see how we can have a proper evaluation and finding the cause, and then we are going to go on to the treatment. So, friends, infertility is a scenario where uh, a couple is not able to conceive even after they try for 1 year after their marriage. And if a couple is more than 35 years, the wife is more than 35 years, then even after 6 months of try, they are not able to conceive. We label this as infertility. Unexplained infertility forms the majority of the causes. The people are not able to know about the cause of infertility. So now, right now, 1 in 6 couples coming to me are facing from the problems of infertility, and that's the issue which we are facing. Once it is infertility, we there are multiple things which come to our mind. What should be the treatment which should be undertaken? Will If I go to the doctor, will the doctor immediately advise me higher end fertility treatment such as IUI, IVF, or so on, or whether I can conceive naturally, whether I need to take some medications? All these options will be discussed with you once, but the consultation is very very important. Before going on to that, we should know about how does pregnancy occur, and then we will be able to understand what are the causes of infertility. So friends, every month in the ovary, ovulation happens, and the process of ovulation begins right from the second day of menses. The follicle formation begins. So it is follicular formation. The follicle grows in size, and towards the 13th or 14th day of a cycle, if the cycle is regular, the follicle ruptures. This is called as ovulation. This can be seen by variety of tests, and we can document it by ultrasound, serum progesterone levels, changes in the body temperature, and so on. After the ovulation, the egg comes within the fallopian tube, and if there is a sexual contact during this period, the sperms will be deposited in the vagina, which transfers travel to the cervix, up into the uterus, and then into the fallopian tube. Now the egg is already there, or even if the egg comes later on, this fertile period where the egg and sperm can unite in the fallopian tube later on leads to formation of fertilized embryo, and this embryo stays within the fallopian tube, travels within the fallopian tube, and in 3 to 4 days time it comes into the uterine cavity. On the day 5 of after ovulation, the embryo implants into the uterus, into the endometrium. So this is normal process of fertilization, that is union of the egg and sperm, and implantation where the embryo attaches to the uterus. If we have seen it nicely, there are four important causes of infertility. First and foremost thing which we check is the semen analysis. So if the husband is having some issues, if there is problem of sexual dysfunction, there are problems with the semen, the sperm count is low, motility is low, morphology is low, then we need to check what is the cause of that. So husband factor is a very important factor in infertility, and if the sperms are not there, if the sperms are not able to go, then how will the pregnancy occur? So there are, in men, there are pre-testicular causes, testicular causes, and post-testicular causes which can be there. So any sorts of infection, trauma to the testes, or obstruction to the vas deferens, all these can pose problem with male infertility. There can be sexual dysfunctions which can also cause problems. Then there can be problems with the count, motility, and morphology of the sperms, which has to be checked. There can be hormonal issues. All this can cause problems in the men. Now, in females, the egg of rupture should happen on time. So this is ovulation. So ovulation has to happen on time. Then, if there is problem with the egg reserve, that is fallopian, that is the number of eggs in the ovary are less or very too high. So these can cause problems. So if the egg reserve is low, the egg quality can go down. The chances of conception will become less. If the number of eggs is too high, we call it as polycystic ovaries. If it is associated with hyperinsulinemia and hyperandrogenism, then this can cause infertility as well, or a syndrome called as PCOS, that is polycystic ovarian syndrome. So, friends, September is a PCOS awareness month. We should understand that a good lifestyle is very important to prevent the risky situation of PCOS. So this is one thing where we check the ovarian reserve. Testing of ovulation is also necessary. Sometimes the egg reserve is good, but ovulation doesn't happen on time. So there are certain tests for ovulation which can be undertaken. There are LH kits which are available. There is ultrasound which is available. There is serum progesterone levels which are available. So multiple tests can help us to detect the if the ovulation has happened or not. So the ovulatory disturbances or problems with the ovary is one factor in females. Then comes the fallopian tube. This we have seen the sperm factor, then the factor in the ovaries, that is the ovarian factor. Now comes the fallopian tube, which is the third factor. So the fallopian tubes, one tube or both tubes can be blocked, or there can be partial blockage, or there can be tubal dysfunction because of which there can be delay in embryo formation. Next, after the fallopian tube is the uterus, where the implantation is going to occur. So if there are problems with the uterus, if the endometrium is thin, if the uterus has, you know, uniformly enlarged due to adenomyosis, or there is some swelling in the uterus or mass in the uterus, such as fibroid, then all this can cause problems for implantation, and this is going to affect the success rates, and it is going to affect the pregnancy outcomes as well. So we have seen four important causes: the sperm factor, the ovarian factor, the tubal factor, and the uterine factor. These four are grossly very important causes, and we at Oasis Fertility initially in the initial investigation try to evaluate what would be the probable cause of this. So why is very important in infertility. Sometimes, after checking all this, we will not be able to figure out the cause. Then we need to keep some provisional causes. This can happen, this can happen, this can happen, and accordingly start treatment. So sometimes everything is normal, but there can be problem with the egg quality. Sometimes everything is normal, the tubes are open, but there can be problem with the tubal function. There is tubal dysfunction, so the fimbrial function is poor. Then there can be problem with gamete transfer. There can be problem with implantation. All these things can happen. So now, whether we are going to do some Gharelu Ilaj, friends, it's a very good option to see a fertility consultant as soon as possible, so that you don't waste on your times and you get good treatment in a proper time span as well. Because as age increases, fertility is bound to decline both in men and women. So seeking consultation within time is very important. Gharelu Ilaj can be tried, but it should be just a portion of it. So it can just help you to change your lifestyle. So once you are diagnosed with any infertile problem, please try to see that these things are followed. So antioxidants, vitamins, and mineral supplements can be taken with the help of doctors. This can boost your immunity. Quitting toxic habits such as alcoholism, smoking, or any drugs is very very useful, because this is going to hamper your fertility. Moderate amount of physical activity for both men and women is indicated in this case of infertility. This can cause many problems to decrease. Fit hai to hit hai. So being fit is always a very good thing, not only to conceive but also for the patient himself or herself. So try to follow a very good balanced diet, and this balanced diet is important to give you good success rates in conceiving. So your food should be balanced between oxidants and antioxidants. Your excessive antioxidant usage can also cause a reductive stress. More oxidative stress can be because of oxidants. So especially have food which is balanced in both these proportions. Have food which is high in proteins. Have food which is antioxidant rich and is with essential oils. This is usually considered a healthy eating plate, where we have vegetables, whole grains, healthy proteins, and fruits. Do not break fast. Always break slow. Take out time for yourself. A morning breakfast is a very good thing. Essential requirements should be fulfilled in the morning rather than taking it down the line to the afternoon or evening. Stress management is very very important when it comes to infertility. That is another aspect of menstrual health. Then there are treatment options. Multiple treatment options are available for infertility. Sometimes the treatments are usually medicines, and this can just suffice and help the patient. But sometimes the patient has some problems, and we may have to undertake endoscopic procedures such as hysteroscopy or laparoscopy. Then there are some advanced ART techniques. So you have intrauterine insemination, which can be tried in certain patients. Then we have in vitro fertilizations or IVF facilities available. So selected patients can use these facilities as well. So friends, infertility can be a larger problem, and sometimes couples can feel aloof. There can be marital issues, there can be issues in the family. All this can lead to disturbed environment. But it is said that I struggle every day, but I leave my struggle invisible. Please don't do that. Please voice your problems and get your treatments within time. There are multiple options which are available during this time. So we have IVF ICSI, or we have laparoscopy, and other options which are available. So there is always a light at the end of tunnel. Don't be afraid of the problems which you have. Other people can have bigger problems than you, and it is always a solution which is available for all these problems. So thank you so much. You can stop the presentation. Thank you so much. I hope we have made your doubts clear about infertility. If you have any questions related to infertility, please call on our helpline numbers given below, which will appear on your screen, and you can connect to any of our centers of Oasis Fertility across India. And if you are in Pune, please connect to us at Oasis Fertility Wakad and Oasis Fertility Chandan Nagar Kharadi. Thank you so much. Thank you. Thank you.